Hello, my name is Dr. Arun Panda. I'm a head and neck surgeon. I practice facial plastic surgery and hair restoration surgery. So let's discuss a very common question which people ask when they want to go in for a hair transplant. Is hair transplant surgery really painful? Now to answer this question, let me just in a few seconds give you a little anatomical description of how the pain occurs. Actually, the scalp where we work for the hair transplant is supplied by sensory nerves. Sensory nerves are the nerves which carry the pain sensation right from the area to the brain. Now if you see the scalp, the front part of the scalp and the back part of the scalp, the front part of the scalp is actually supplied by a couple of important nerves called the supratrochlear nerve and the supraorbital nerve, which supplies the front aspect of the scalp region. And the back part of the scalp, that is this part wherein we take the donor from, the grafts from, is actually supplied by the greater occipital nerve and the lesser occipital nerve. There are a few more nerves, sensory nerves, which supply the sides of the scalp also, like the zygomaticotemporal nerve and the auriculotemporal nerve, which also supplies the side as I mentioned. So these nerves all together, they carry the pain sensation. Now normally what happens when we want to do a hair transplant, we take the grafts from the back side of the head or the scalp and put it on the front. So while doing this, we give something called as a local anesthesia. That means the whole hair transplant is basically done under local anesthesia. We do not give general anesthesia. So the local anesthesia which we normally give contains lignocaine and a long-acting local anesthesia called the bupivacaine. So these local anesthetics simultaneously they work together and they give profound anesthesia or pain relief over the whole area of the scalp. Now what we actually do is very meticulously we actually first give something called as a nerve block, that is we block these nerves, these important nerves, pain carrying nerves all around the scalp, and then we do something called as a ring block. In this what we do is actually very close to each other we keep on giving the local anesthesia, and after that what we also do is something called as a tumescent anesthesia, wherein more amount of saline or fluids along with a little amount of the lignocaine is what we inject to kind of tighten the scalp to work. So these kind of anesthesia when we actually provide, it actually gives absolutely no pain to the patient while we do the surgery. We can actually work for almost 6 to 8 hours when we are almost doing 3000 grafts. The video which we are going to see now, you will see here how we are using something called as an insulin syringe with a very fine needle, almost 31 gauge. It's very fine and we are giving the anesthesia. It's only the first prick which is slightly uncomfortable, and after that there is absolutely no pain whatsoever. So you're going to see that in the video. Once we are done with the surgical procedure, most of our patients do not complain of any kind of a pain or discomfort. For the first day, all my patients, they say, "Doctor, we have just taken one analgesic pill or the painkiller pill, and after that actually we did not require it. So is it necessary for us to take the painkiller?" We say, "No, actually if there is no pain, you don't have to take the painkillers." So 99% of the patients normally do not complain of any kind of a pain after the first day or after the day of surgery. 1% of the patient may complain of slight discomfort just for another 24 hours, and most of them do not complain anything after 48 hours or the first or the second day. So as I was saying, we work very meticulously when we are giving the local anesthesia for doing the surgery, and 100% I can assure you that you will not have any pain during the surgery and the post-surgery. Thank you, and if you have any queries, you can always come back to us, you can write to us, And if you like this video, you can please like and share this video. Thank you so much. Dr. Arun Panda, maxillofacial surgeon, facial plastic and hair restoration surgeon, Mumbai. Thank you.